information to caregivers about safe sleep practices that have been proven to work and to keep babies safe. And so, also one of the benefits of being part of these groups, is it allowed us to have a strong relationship with the health department and be more for healthy babies. And so we're happy to have Jan and Kathy with us, who are really much more experts in this area than I am. And so they have offered and agreed to be here with us today and just help us understand this issue and get some strategies for making sure that we are able to share it with caregivers that we work with.
Hi all, thank you Mark for that welcome. Oh, Jen, I'm sorry if I interrupted you. I was just gonna share, I'm Kathy Costa with the Baltimore City Health Department, Bureau of Maternal and Child Health, and I lead the strategy for the Be More for Healthy Babies initiative and infant mortality prevention initiative for Baltimore City, and also lead the child fatality review. And I'll let my colleague Jen introduce herself.
Hi, everyone. So glad to be here today. I work with the City Health Department and BHB on our behavioral health initiatives that occur in the prenatal and postpartum periods mostly. I just want to note that I can't see your chat or yourselves, unfortunately. So speak up, or maybe somebody else, if they see something in the chat, can call it to our attention.
Sure. Yep, we can do that.
All right. So I'm gonna go over quickly our key questions for today's training and then kick us off. So first, we're going to talk about what are sleep-related infant deaths. Many of you have heard the term SIDS, and terminology has changed a bit over the years, so we're going to talk about that. We're going to talk about which infants are most vulnerable to dying in their sleep, so that we understand how these deaths occur and who is at risk. Number 3, how can we prevent sleep-related infant death? And we're going to teach you about the ABCDs of safe sleep: alone, back, crib, don't smoke. And then 4, we're just going to kind of go briefly over some strategies that providers of many kinds can use to educate families on infant sleep. Next slide. Okay, so we're going to start in with question 1. What are sleep-related infant deaths? So a sleep-related infant death occurs when there is a death of a baby before their first birthday. It occurs during sleep, which could be nighttime or a nap. And after they investigate the death, they know that the baby's death did not result from a medical condition or a prior injury. And basically what this means is they suspect that the baby suffocated during sleep. Sometimes there's clear evidence of that. Sometimes it's murky. But here's how these deaths can occur. So you see these graphics. The one on the left side, soft bedding, is the most common. So accidental suffocation can occur when a baby is asleep on a soft surface or soft bedding. And you see the baby in this picture, the head is pressed into a pillow, there's a blanket, the baby's sleeping on his tummy. And so you know, his nose and mouth are more likely to come into contact with this soft bedding. So that's the most common way this happens. The second most common way is something called overlay. And that is when the baby is sleeping with another person, could be a parent, could be a child, could be multiple people. And that other person rolls on top of or against the infant. And you see in the middle picture here that the mom has kind of rolled over, and her arm and shoulder are compressing the baby's chest area, which compresses the infant's breathing. And that's a fairly common occurrence as well. And then the third one is much less common, but it definitely still happens, and that's wedging or entrapment. And in the picture on the right, what you can see is that the baby has gotten caught, has fallen between the mattress and the wall. And when they're sort of crushed in that spot and not able to move, they're not able to breathe. We've also seen this happen between the mattress and the headboard. But it, like I said, is much rarer. So next slide. So sleep-related deaths in the country have declined after new guidelines. So there were new guidelines in the 1990s, and it was called Back to Sleep. And there was a Back to Sleep campaign, and that was when they realized what was causing some of these deaths. Before that, you might have heard them called SIDS, and sometimes people still use that terminology. And people thought there was nothing you could do to prevent SIDS, but it turns out that's not the case. They realized fairly early on that putting babies on their back to sleep helped to prevent SIDS. And so when people started putting babies on their back more often, the numbers came down, but then they stayed stagnant. And now we know a lot more about these deaths, so much so that we really don't use the term SIDS anymore, because people think of that as something that's not preventable, and these suffocation deaths are actually preventable. And so we're really trying to do whatever we can in Baltimore City to bring these numbers down. I will say in Baltimore City, we have been very successful in bringing them down until the pandemic, when they started to increase again. So they went up in 2020, up further in 2021, up further than that in 2022. We had 18 city babies in 2022 die, and we sadly so far in 2023 are at 16. So this is a real issue that's affecting a number of families in Baltimore City. Next slide.
Thanks, Kathy.
Yep, go for it.
Yeah, so the second thing we want to talk about is which infants are most vulnerable to this type of sleep-related infant death. One model is called the triple risk model. While any infant in an unsafe sleep environment is vulnerable to death or severe disability, some circumstances add up, making some infants more vulnerable. For example, a healthy infant with no risk factors can become wedged within a wall and a mattress or be suffocated via overlay. Also, the risk for sleep-related death is cumulative. So the greater number of these risk factors present in the infant and the environment, the greater the risk of death. And Mark can send out to attendees a copy of this, because we don't want to read through every single thing. Is that okay, Mark? Yeah. Okay, great. So we're going to talk about a few of these factors today. What we see, this is just our findings from Baltimore City has something called a child fatality review. And when there are sleep-related infant deaths, by far the most common associated event is that the infant was not sleeping in their crib. But then you see up here, a good number the parents had a documented mental health condition, or there was confirmed tobacco exposure in the home. So those in Baltimore City are some of the top factors. Now we want to focus on, we're going to focus on two factors today that as behavioral health providers may resonate more with the population you're serving. So 1/3 of infant sleep-related deaths in the United States are attributed to smoke exposure. And smoking, what's important to note is smoking doesn't just affect a baby's lungs, but also the brain and how it's able to be woken up. So exposure to tobacco or nicotine in the womb and as an infant are the leading preventable causes of sleep-related infant deaths. We know that infants who die in their sleep have higher concentrations of nicotine in their lungs. It raises infants' risk of respiratory illness and thus their rates of hospitalization. Smoking releases carbon monoxide and nicotine into the mother or birthing person's body that crosses the placenta, enters the fetus's bloodstream, and affects the developing organs, including the lungs, the adrenal glands, and the brain. And so it's important to note that smoking doesn't just affect the baby's lungs, but also the brain and its ability to be woken up. And this is partly thought to the chemicals in secondhand smoke, and that they affect the brain in ways that interfere with its regulation of infant breathing. For secondhand smoke, second and third hand smoke, it's important to know that after smoke has been in the air, it settles and surfaces rooms throughout the building, and it can then still be inhaled by children or ingested by them putting things in their mouth. So opening a window, sitting in a separate area, ventilation, air conditioning, they cannot eliminate secondhand smoke exposure. And this is really important for small babies. The next factor we want to focus on is caregiver drowsiness. So when a caregiver is more difficult to arouse, some circumstances are more dangerous than others. For example, bed or surface sharing when somebody is difficult to arouse, maybe because they're intoxicated or because of the side effect of certain medications, increases 10 times the baseline risk. And then the use of alcohol and tobacco together. So if the birthing person is using tobacco and alcohol in the second and third trimester, then it's 12 times the high risk of sleep-related infant deaths. So you want to pay attention in certain circumstances. So if your client says to you that they've started a new medication, or and you know it's to be sedating, if they're taking it a different way, when their body changes during pregnancy and postpartum, the amount of blood when you're pregnant, the volume increases, and so that medication may change effectiveness, or they may have a doctor. For example, the methadone dose is often adjusted when someone becomes pregnant, and that is needed for therapeutic amounts. But while titrating it, before you get it right, it may cause excessive drowsiness. And methadone has a long half-life in the body, so that's something particular you want to pay attention to. So these can be opioids, benzos, antipsychotics, antihistamines, blood pressure meds, alcohol, and sleeping pills. These are the main medications we think of that have this drowsiness side effect. Okay, so now we're going to talk a little bit about how we can prevent sleep-related infant death. Although, should we pause? Are there any questions or anything in the chat?
I don't see anything in the chat, but if anyone does have a question and they would like to just unmute, please feel free.
Okay, well, we'll continue. There's some more chances for interaction. So we want to talk about how can we prevent these deaths? Well, we know that there are a lot of cultural, social, financial, and other factors that influence how a caregiver puts a baby to sleep. I'm going to ask it to you guys now. How might one of these factors either risk or protect babies from dying in their sleep? And you can also name if there's a major one you don't see listed here. Just come off mute.
Just being fed, and they can, I guess, silently aspirate.
Okay. Right. So the factor is where or how the baby is being fed. Sorry, that's my I don't want to say the word out loud or I'll start talking again. Yeah, so what's going on in the family home? How are they doing different activities? What else? we know a big one that we hear a lot. It kind of combines this cultural practices and norms and advice from partner, family, and friends that people say, well, you know, the grandmother put the baby to sleep, put me to sleep on my side or my stomach, and I'm fine. Or that's just how we do it in our family. And so you may have those expectations or pressures, and then this seems like mixed messaging. But what it is we know better now. We know how to save infant lives due to sleep related infant death. We also know, for example, trauma. Some people who are at risk of involvement at CPS have a fear that their child is going to be taken away, or maybe they've had a child taken away before and they don't want to part with them even for the night. You know, it's a trauma response. Anyone else have anything to share about how these factors might influence how caregivers put their babies to sleep?
Melina wrote in the chat, infant fussiness could cause a parent to do whatever it takes to soothe the baby, using blankets, laying with them, etc.
Yeah, if a certain product seems to work well and you've been up and the baby is crying and crying, there you can get to a point where you're really frustrated and you just want anything that works. That's a very real point.
I know when I was a mother of a newborn that parent fatigue played a role, because sometimes you just fall asleep holding them. Not that you meant to, but you know, you fall asleep with the baby sometimes in the middle of the night.
That is. And what's one thing you think could protect against that? How, like, parents are going to be tired, they're going to fall asleep. How can someone make sure that their baby is in a safe sleep environment?
I don't know. It's tricky. You can prep the space to make it as safe as possible. Maybe have your partner wake you up. It's not everyone has a partner though, or family support. So
Correct. Those are both good examples. And as you pointed out, everyone's situation is different. But if you have the crib or the pack and play or the bassinet with stuff all in it, you're going to be much less likely to put the baby in there when you're tired than if it's all ready, you got their swaddle laid out, and it's clean and those type of things. So there are things we can do, but yes, sure, it's not a guarantee. One thing I do counsel to people who are going to be with others who may be intoxicated or otherwise drowsy is to keep an eye on, to make sure there's always someone who's awake in the house. And if need be, even if that's over FaceTime or something like that. So there are little things you can do that they're not ideal, but are a bit better. So which photo on here, if people can just type in the chat, 1, 2, 3, or 4, which one or several of these do you think displays safe sleep? Okay, I'm seeing a few ones. 1. All right, well, this is a very knowledgeable group. That is true. Number 1 is the only photo that depicts what we would call a safe sleep environment. Oopsies. What you see is and these things were all taken from social media. So you really have to be careful to utilize evidence-based sources. People are well-meaning, and you know, these photos look cute, but they're cues that they're not safe. We've got like a little boppy thing that someone's in with the blankets. They don't need a hat or those other things. We don't need any crib bumpers. In fact, they're illegal to sell in Maryland. Okay. So here, this is a long detailed list, but how can we put babies to sleep safely? These are the American Academy of Pediatric recommendations. So these are the gold standards. You will see this when you get the handout. And what does safe infant sleep look like? How do we get families there? So this is just another photo that one thing you want to do to your clients is teach the ABCDs of safe sleep. So that's alone, back, crib, and don't smoke. And what we know is that 3 practices in particular increase an infant's risk of death more than 10 times. We talked about this. Bed sharing when the parent's alertness is impaired due to fatigue or medications. When the parent is a smoker, or if the infant is asleep on a soft surface such as the couch or waterbed. So alone, there should be nothing else in the crib. No other people, no other stuff, no little cute headbands, nothing. Just your baby. And if your baby's wearing the sleep sack or the swaddle, that's okay. But nothing that's loose and can get like tied around your baby or stuck with it in the wedge in the crib. You also want to keep your baby warm, but not too warm. We're getting into the winter here, and people think they need to really layer up their children. That's really not the case. Ideally, you keep the room around 72. We know that in Baltimore City, people may be struggling with their heating, or in the winter with their heating, or in the summer with their air conditioning. So do the best they can, but dress babies in no more than one more layer than what you're wearing. You also don't want to swaddle it when the baby can roll. That's when it's time to switch to just a sleep sack where their arms are free. They should also sleep on their back. This is the safest position for sleep because they can arouse more easily and less likely to have their airway blocked. Some people say, oh, well, they'll choke. What if the baby has reflux? Well, on the stomach, spit up flows into the tube to the lungs, which causes choking. And on the back, this same spit up flows into the tube to the stomach. So it is actually safer anatomically speaking. The next is that babies should sleep in a crib. And when I say crib, that could be a traditional, what you think of, that could be under a certain weight, that could be a bassinet. It can be a pack and play or other sort of portable crib. It should be clean. It should have a firm mattress and a tight fitting sheet, nothing else. You don't need any special pads. You don't need a thicker mattress. You don't need a wedge. The most alarming statistic involves the risk of allowing infants to sleep on couches or armchairs. Doing so is 22 to 67 more times more likely to result in infant death than putting them to sleep in their own crib or bassinet. So the softer the surface, the more area there is to slide around, to get caught in something, the more likely an infant is to get caught and suffocate. We talked a little bit about what counts as a safe crib. These are some images, and in an emergency, a laundry basket, a drawer, etc. will work. However, these things are not safe. Most of them are banned. Swings, boppies, DockATots. They are for awake time early. We are regularly hearing about deaths, both locally and in the news, due to babies sleeping in one of these, and it's completely preventable. If your baby does fall asleep in one, we get it, it happens. Try to gently transition them into their safe sleep space, into their bassinet, their crib, or their play yard. This is just talking a bit about the safety standards that went into effect in 2022, which limits these products being sold on the original marketplace. However, as we said, there are secondhand outlets, Facebook Marketplace, Craigslist, swap pages. I just got a note that this will end in 10 minutes, by the way, because it's the free version. So I'll talk extra fast.
Oh gosh, I don't know
And the
why
last-
that would be.
Yeah.
We'll go quick.
The last one is don't smoke. We already kind of talked about this, maintaining a smoke-free environment where your children live or play. We talked about why this can happen, because it affects not only the baby's breathing in terms of their lungs, but as well as it impacts the baby's brain, so that the way it is aroused is changed. I'm going to pass it over to Kathy for the strategies for educating families on safe sleep.
Thanks, Jen. So the goal for working with families, we really want to reduce their infant's risk of sleep-related infant death. And we can do that in many ways. We can share information with the families, really those ABCDs of safe sleep that Jen just went through. Within a conversation, we can answer their questions and concerns. If we're actually in the home, or if they're talking about their sort of home environment, we can actually help them troubleshoot the physical environment, and we can offer and connect them to resources. Next slide. So one of the things that is recommended if you are educating or counseling families around safe infant sleep is using, sort of motivational interviewing or motivational interviewing light. And I know many of you as behavioral health providers have been trained in motivational interviewing. There's a little acronym, LOVE, that folks recommend for doing this with families around safe sleep. And I always feel like it should be OLOVE, because I think you should start with an open-ended question. And that open-ended question could be, how are you planning to put your baby to sleep? Or how do you put your baby to sleep now? And then the idea is L, you listen with empathy when the family describes their current sleeping practices. And then you might ask some follow-up open-ended questions. If they say that they're bed sharing in an adult bed, you might ask what the caregiver likes about bed sharing, or maybe what makes it hard to put their baby in a crib or a bassinet. What struggles are they facing? And then when they respond and talk about, what they're facing, what they like about it, what their struggles are, you really validate what you're hearing and you acknowledge the family's desire. And often that's to do what they believe is best for the baby, or to help the baby get a good night's sleep, or to help the whole family get a good night's sleep. And so you really want to acknowledge what they're trying to do. And only then do you come in with E, education. And then you might say, we get new research all the time, and this is what we know about babies. Or if that a particular client's baby has a risk factor, like being born preterm, or that the baby was exposed in utero or secondhand to smoke, you might share some specific information about their risk and how they can mitigate it. Next slide. And so these are some great open-ended questions that you can start with. What are your plans for how your baby will sleep during naps and at night? Or where does your baby sleep? What questions do you have about safe sleep? Because we know fussiness and fatigue are such a big deal. What could you do for support when your baby is fussy? Kind of prompting around that. Next slide. Here is where helping families troubleshoot come in. One of the things we see in child fatality review all the time, as Jen was talking about, is that many families have a crib, and due to limited space or just sort of challenges in general, it's being used for storage of baby items. So one of the things you can help a family do is identify where else they can store everything that's being stored in the crib. You can also help them maybe position a safe sleep surface in each area where the caregivers are. So they could make sure that they have a crib in the parent's room next to the parent's bed. They could have a pack and play in the family room next to where parents hang out and the infant might nap. You can help avoid inadvertent bed sharing. This kind of is getting back to what Jen was saying about, what could you do to kind of head off an inadvertent unsafe sleep situation. So if you're feeding in the bed, for instance, you could remove all the pillows and the loose beddings if you're afraid that you're going to fall asleep. You could set an alarm on your phone. The client or the parent could engage in activity, and when they're feeding, watch their favorite television show. They can move the crib near the adult bed so that it's very easy to put the baby down. You can also, as Jen said before, identify an adult who will be awake and can check on the caregiver and the infant, and even if that's via video chat, especially right after taking medications that might be sedating, like opioids or antipsychotics, allergy meds, or sleeping pills. And one of the things I think you can also do, especially as a behavioral health provider, is share strategies for soothing a fussy infant and maybe coping with some of the frustration and difficulty that that parents can experience. We have lots of resources and they are free for teaching the ABCDs. We mentioned we were a part of the Be More for Healthy Babies initiative in Baltimore City on our website. And there's the URL at the end. We have safe sleep videos. We have free RAC cards. We have FAQs. So anything you might need to teach those ABCDs very simply is right there. And we also have resources. Here are some, you probably already know some, but key phone numbers. In Baltimore City, you can call HCAM, which is Healthcare Access Maryland, and you can refer a client who has financial need for a crib. They can also get health insurance, Medicaid, and linkage to care and lots of other community resources. That's an important number. If your client is smoking, you can refer them to the Tobacco Quit line in Maryland. There's also, some of you may not know, there is a 24/7 confidential free parenting helpline offered by the Family Tree in all throughout Maryland, actually. And so parents can call if they're having trouble with a fussy infant or really any parenting challenge. They can call and get free confidential advice and guidance. And then, of course, behavioral health crisis intervention line 988, or for help scheduling an outpatient appointment. And then last but not least, we're quickly wrapping up, is these are resources, the top one being our website, healthybabiesbaltimore.com, but resources where you can find good information on how to teach about safe infant sleep. And it is our hope that you all will be willing to incorporate that into your practice with clients. Jen, do we have enough time to do the practicing? I don't know when it is going to time out.
It's showing as 2 minutes.
2 minutes. Maybe we should just ask questions. Ask if there are questions, or yeah. Okay. Does anyone have any questions? We only have these 2 minutes left, so we're happy to help.
Sorry, I was frozen on mute.
Oh, no problem.
Did anyone learn anything new today that they think they can take back to their clients?
Melina says this is great. Thank you for the resources. Thank you.
Thank you so much for coming.
Yeah, we really appreciate it. We're trying to do whatever we can to spread the word. And Liz says, yes, I was unaware of some of these important tips. Good, good. I'm glad it was helpful.
It was really helpful, especially the information about the risks associated with smoking. That's a hard one for my clients. There's a lot of, that's like their panacea for all the things that they aren't able to do.
Yeah. Completely understand. It's so hard to.
If they can't quit, maybe they could cut back. If they can't cut back, maybe they can make sure they're going outside every time. Wearing a blanket or a special coat that they take off, washing their hands before they touch their baby.
Yeah, those are all actually really helpful.
Include their partners as well.
These are unpartnered women.
Oh, okay.
And just real quick, the question about the flyers, I believe that yes,
they're on our website.
Yeah,
you can print our latest flyer there. Yep.
Yeah.
Also, if you want materials, I hope is our contact information on there, or Mark, if you could send it out. We're happy to mail or drop off. Yeah,